Greetings once again. It's a pleasure to be back, and it's a pleasure to have this conversation with you. So for today, I'm going to talk about the future of healthcare practice in Kenya, especially for young Kenyan healthcare workers. And the dynamics of it, as we know it, the best thing to talk about the future of healthcare is to start from where are we now, then where did we come from, and what got us to where we are, then what needs to change in the next phase, and what we need to achieve towards a future that is prosperous and actually a future that is enabling to ensure that as healthcare workers, our core mandate is to ensure our patients have access to quality healthcare services. And access to quality healthcare services then means that our patients are able to get the quality care they need, they're able to get the medication that they need, and these services are being offered by qualified, competent, equipped, and actually resourced healthcare workers who can make that a reality. So where are we now? The current state is we know that our healthcare workers are not being recruited as much, and when they're being recruited, the terms of engagement are not as competitive and not as conducive, and actually most of our healthcare workers are opting out to leave the country for actually jobs abroad. That is one option. Two, most of them are transitioning from actually the clinical healthcare roles to other roles which are not aligned with their healthcare work. So the question is, are we not just actually losing our investment? We really are, and we need to look at how to ensure that that investment in training and capacity building of our healthcare workforce to be able to serve the public does not go to waste. If that is done, then we'll be in a better position. So as much as that is a challenge, starting from the point where we are, then when did things start changing? 2013, we had the devolved governments coming into place. With devolution coming into place, then the first thing is healthcare service delivery was devolved as a function, but at the same with national coordinating function left at the national government level. So the national government will do the policy and restructuring and actually regulatory guidance, but the county governments are doing the implementation and the coordination of programs and activities. That coordination at the local level included employing of healthcare workers. And therefore, the employment is at the local level, management of everything is at a local level, and then government is financing by the treasury disbursing funds to counties, which then the counties will determine how they are going to use based on their local needs. And based on that, then the devolution of the functions, one of the key things that happened, every county had its own recruitment terms. And therefore, in some counties, you'll find the terms might be competitive, and therefore more healthcare workers will definitely want to go in a more competitive work environment, and also more fulfilling and more resourced in the sense that they're able to offer better services. In counties that are not able to do this, then they're suffering from that because their people are not able to have access to quality healthcare services. So it's kind of bringing a kind of two-tiered governance system where it's a two-tiered government system and also a two-tiered healthcare service quality framework, in the sense that some areas would have the best quality of care, some don't. That is a failing of our government, and we need to see how do we make those things come to an end. Then after that, we have the 2017 collective bargaining agreement that was signed between the government and the Kenyan Medical Practitioners and Dentists Union. In this kind of a collective bargaining agreement, the terms of engagement were reviewed, and actually, as per the Salaries and Remuneration Commission, was structured based on a competitive global standards, and at the same time understanding of the local prevailing conditions and circumstances. When you look at those terms as they were competitive, and they were enabling us to ensure to have our healthcare workforce retaining our governments and actually motivated to continue doing the work they do. Unfortunately, after that collective bargaining agreement, there's one thing that was lost: the transition and the recruitment of healthcare workforce. After training, you're left to fend for yourself and find ways of getting recruitment. That became a bottleneck in the sense that you're not sure when you're going to get employed, you're not sure on which terms you're going to be employed, and therefore, as a healthcare worker, then you need to ask yourself, where do I go? And that created a gap, and that gap has been exploited to give healthcare workers uncompetitive terms of employment. That is one. To be abused and actually to be manipulated by the employers, including the county government in certain circumstances. And these are things that need to be looked into and to ask ourselves, is it fair? And to an extent, actually, it had been implemented by the national government during COVID pandemic, because we had a collective bargaining agreement outlining the terms of employment of healthcare workers. But when the same government structures new contracts, and these contracts are being used to employ healthcare workers, which are not in line with the initial signed contractual agreement between the employer and the union. And then this is what we're going to argue against. How do we address this? And these are challenges that as young professionals we're going to contend with, and we have to contend with them to ask ourselves, what future do we want for ourselves, and what future do we want for our healthcare systems? So yesterday when we had that conversation, then these kind of things were coming up, and one of the opportunities that I found exists in this area is the fact that one, In terms of our training, we have an opportunity to identify now what are the next frontiers. Who are the people making decisions for us, and who are the people making the governing and the governance decisions in the healthcare sector where we operate? Most of these people don't understand the integrities, the in processes, and actually challenges that we're dealing with. And therefore, it's an opportunity now for us as healthcare workers to ask ourselves, what does it take for us to get into the leadership positions, to make the decisions where they need to be made, and to call everybody to account and hold people accountable, ensure that our patients who count on us, our patients who depend on us to make the right clinical judgment, are able to get the right clinical judgment in terms of the care that they need, but they also assured that whenever they come to a hospital, the equipment, the x-ray machine they needed for them to be diagnosed is available. The medicine they need to be able to recover from the condition they're suffering from are supplied and are available in the hospital. If that doesn't happen, then we'll not be serving our duty, and we have to hold ourselves and hold the government accountable and all the stakeholders who are managing this kind of an ecosystem. That will be the key thing that we need to do. Then beyond that kind of accountability and actually taking the leadership position, is the first thing is healthcare workforce from a collective social contract and social service is a responsibility of the government. And then from our end as healthcare workers, it is our responsibility to come together. The healthcare system is as strong as David is strong in his practice as a pharmacist. And it's as strong as David and his colleagues are able to perform at their different areas of practice. Every function, every line of duty where we work, we have a role to play to ensure the whole healthcare system is thriving. And ultimately, that would lead to the professional fulfillment and the professional prestige that comes with it. But at the same time, that professional prestige actually accords us the sense of excellence and optimal service delivery to ensure our patients get the ultimate outcome and the benefits of it. So how do we make that happen? It's by us coming together and asking ourselves, how do we shape the future? And it's not going to be an inter-cadre war where one cadre is fighting another cadre. And that is one thing that has been used by our leaders and our governance systems to ensure that we have factions within the healthcare system. I don't think those factions help anyone. They are going to make us stop the fight for what really is justified, what is good for the general public, but then we start fighting internally because of our own misfortunes, and our misfortunes should not be the misfortunes of the patient. They should not be propagated to the patient to suffer. We have to hold ourselves accountable. And one thing that I'm grateful for is the fact that from young professionals' perspective, the Young Pharmacists Group, Young Doctors Network, Young Nurses Association, clinical officers, radiographers, dentists, we are coming together and start having these robust and open conversations, including at student level when the Kenya Healthcare Student Summit is facilitating this engagement. Let's share perspectives. Let's come together and ask ourselves, because we are all from the same background in terms of training, we understand the dynamics of the environment we're coming into. We understand the challenges of what the healthcare system has. How do we shape a better future? With those conversations, then we are now able to bring in new ideas, new thoughts, processes, and actually champion for them to be adopted by our professional associations and our employers to ensure that ultimately the end game is that we have reliable, sustainable healthcare systems that are going to serve the general public. But as we do that as well, we need to hold our professional associations accountable. They need to start by engaging at the vantage point to know that we are not going to fight inter-cadre wars. We are going to have our professional associations forming allies, and those allies are on the three key principal pillars. One, access to quality, affordable, and universal healthcare to the patient that need them. That is the first key pillar. Ethical practice and professionalism in care delivery. Accountability and social responsibility in service delivery, professional standing, and ensuring that we are serving what our purpose is. If we're able to commit to that and hold each other accountable, then ultimately the patient will benefit, we will benefit, and ultimately we have a working healthcare system. And that is what we need. So the future of healthcare practice is about us coming together, shaping the future we want, understanding the bottlenecks and the challenges we've had, and drawing a path that we are all committing to get to. That will be our future. But if we don't do the work, it won't happen. It will just be a dream. And I don't think any dream will ever materialize unless somebody puts in the work. So my call to you is the future of healthcare practice depends on us as young professionals taking up the mantle, doing what needs to be done, and investing in it by knowing that as much as I've been trained, the role that I'm going to play in the healthcare system is not only for me. It's for the people, for the patients, for my sister, for my siblings, for my mother who is going to go to a hospital and might not be able to get the medication they need. How are you making that possible? Let's make a difference. Thank you so much, and engage this Sunday. Thank you.